Good afternoon. Welcome to the Heritage Foundation and to our Lewis Lehrman Auditorium. We, of course, welcome everyone who joins us on our heritage.org website on all of these occasions, and would ask everyone here in-house if you'll make the last courtesy check that cell phones have been turned off as we prepare to begin the program. We will post this event within 24 hours on our website for everyone's future reference as well. Hosting our discussion today is Nina Ochorinco, who is director of our Center for Health Policy Studies. She is also a past recipient of Heritage's W. Glenn and Rita Ricardo Campbell Award for her outstanding contribution to the analysis and promotion of a free society, particularly in her work on the S-chip debates. Before joining Heritage, she served on Capitol Hill working on the House side for then Representative Jim DeMint as well as Representative Sue Wyrick, and she also worked in the Senate earlier than that, working for Senator Jesse Helms. Please join me in welcoming my colleague, Nina Ochorinco. Nina?
Well, thank you, John, and thanks to all of you for being at our event today. Tuesday night, President Obama barely mentioned his landmark legislative victory, the Patient Protection and Affordable Care Act. And there's no wonder. The Americans continue to dislike the health care law more than they like it. It seems every day there's a new glitch or contradiction that surfaces, raising more doubts that this elaborate plan can actually work. Further complicating matters for the administration is the decision by the Supreme Court to consider the law's constitutionality. While we wait to see the case unravel in the coming months, it is still critically important that Americans are reminded that unless the Supreme Court strikes down the law in its entirety, there is still plenty to be concerned about. Today, we are going to hear from a distinguished panel of healthcare experts who will discuss why full repeal must remain a top priority and to help provide an alternative vision for what a responsible healthcare reform proposal would look like. Let me please take a few minutes now to introduce them to you. First, Sally Pipes, President and CEO of the Pacific Research Institute. Sally is the author of two notable books that we have out front on the healthcare law: The Truth About Obamacare, which was published in 2010, and her newest book, The Pipes Plan, The Top 10 Ways to Dismantle and Replace Obamacare. Second, we'll hear from Michael Tanner, Senior Fellow at the Cato Institute. Michael penned an excellent review of the healthcare law in Bad Medicine, a guide to the real cost and consequences of the new healthcare law, which has been newly updated and revised. And finally, last but not least, we will hear from Grace Marie Turner, President of the Galen Institute. Following enactment of the healthcare law, Grace Marie, alongside Jim Capretta with the Ethics and Public Policy Center, Tom Miller at the American Enterprise Institute, and ours truly, Bob Moffitt of the Heritage Foundation, joined together to publish the book, Why Obamacare Is Wrong for America. Please help me in welcoming them to Heritage today. And we'll start off with Sally.
Well, thank you, Nina, and thank you, Heritage, and I'm delighted to be here with my friends Mike Tanner and Grace Marie Turner as well. With a historic vote, the 2,700-page Patient Protection and Affordable Care Act was passed into law on March 23, 2010. How fast 2 years have gone. It's almost the second anniversary. And as Nina mentioned, it was interesting to me that at the State of the Union on Tuesday evening, the President devoted only 44 words to health care reform. And I think it has to do with the fact, as Nina also said, that only about 53% of Americans support repeal of this legislation. So I wrote my first book, The Truth About Obamacare, because when Nancy Pelosi said we have to pass this law to find out what's in it, I thought I could write something in 270 pages to actually say what is in it. Unfortunately, I doubt she's read my book. My new book, The Pipes Plan, The Top 10 Ways to Dismantle and Replace Obamacare, was in response to the people that are always criticizing the members of Congress who support repeal. Well, you don't like the law, but what is your plan? So I thought I would just do a 10-point plan, giving members of Congress, staffers, some idea of what some of the ideas should be for repeal and then replacing it, to have a positive agenda. I like to say understanding health care is similar to unraveling an onion. There are many layers and many tearful moments. We all want to find affordable, accessible, quality care for all Americans. That is our goal. How do we achieve that goal? There are two visions. One which focuses on empowering doctors and patients. The other focuses on increasing the role of government in our health care through increased taxes, mandates, subsidies, and ultimately controls on insurance companies. Remember, Obama gave 58 speeches on health care before it was passed, the law was passed, and he started talking early about health care reform, but switched in August '09 to talk about health insurance reform. So the president gave, as I said, 58 speeches, but he also, I think, ultimately wants Medicare for all. I think he really wants a single-payer, Canadian-style healthcare system, which I grew up in Canada. So how do we achieve universal coverage and bend the cost curve down? The United States in 2010 spent 17.9% of gross domestic product on health care. It's a lot, but we demand the very best. Americans are impatient. They want everything right now. Canada, the country I'm from, spends about 10.4% of GDP on healthcare. The global budget is set by government. But of course, Canadians demand much more in healthcare, so you get long waiting lists. And the Fraser Institute, where I worked until 1991, we started a publication called Waiting Your Turn, a guide to hospital waiting lists in Canada. Last year, the average wait in Canada from seeing a primary care doctor to getting treatment by a specialist was 19 weeks. That's almost 5 months, and it's the longest time since the recording of wait times. So it's very, very important that Obamacare be repealed and replaced with an agenda that brings about affordable, accessible, quality care. The other point is that doctors, I believe that a lot of doctors are going to get out of the practice of medicine unless this law is repealed. Deloitte Touche has said that about 75% of doctors are upset about Obamacare, and it's going to impact negatively on how they practice medicine. The other key point is that study shows that 69% of doctors feel that the best and the brightest are not going to go into medicine, and that is very discouraging for the future of our health. In my book, The Truth About Obamacare, I talk about a number of pillars, about 14 of them, but we don't have time today. I'm going to talk about some of the replacement issues. But the president wanted universal coverage and to bend the cost curve down. Those were his two main goals. We are not going to achieve universal coverage, the CBO says, by 2019. 23 million Americans will still be uninsured. We're going to add 16 to 18 million people to Medicaid, the program for low-income Americans. And if you look at the uninsured number, 50.2 million Americans, 17 million of them are already eligible for Medicaid and S-CHIP and haven't signed up. The question is why, and I believe it's because doctors get very low reimbursement rates, even lower treating Medicaid patients than Medicare, and therefore these people turn up at emergency rooms because they do get care there. On bending the cost curve down, the president wanted a bill that cost $900 billion over 10 years. It came in at $940 billion over 10 years. The CBO says today it's already up to $1.5 trillion. And I believe, as many of us here on this panel, in the decade 2014 to 2024, the cost of this legislation will be about $2.5 trillion, maybe even more, because the real cost drivers, adding people to Medicaid, the individual mandate, the employer mandate, the adding of 16,000 new IRS agents, the ending of discrimination based on pre-existing conditions, and of course the ending of the annual limit or lifetime caps. Those are going to be huge cost drivers, and Obama was politically astute in bringing in the cost drivers after the 2012 election. The individual mandate, I think, is a very bad idea. The Galen Institute, PRI, the Benjamin Rush Society, and Docs for Patient Care, we are filing an amicus brief in the Supreme Court case on the individual mandate and its impact on uncompensated care and what that's going to do to the cost of care. The court will have 3 days of hearings starting March 26. We expect a decision at the end of June. The court is considering a number of issues, the individual mandate, the issue of severability. How can the states be forced to add all these 16 to 18 million people to Medicaid? And, of course, the Anti-Injunction Act. If this is a tax, which I believe it is, how can the court Can the government start counting attacks before